it would be interesting, and I'd be curious right now, if I had a staff to do this, I'd send them to all 50 states, because you know what? 25 to 30% of their traffic on their website today is people trying to figure out the vaccine. So I would think there would be a banner on the state website that says, if you are looking for the vaccine and how to get the vaccine and what our guidelines are for our state, click this button. And it would be interesting to see how many of the 50 states are even remotely close to that.
Yep. So I'll tell you, because I just went to our rhodeisland.gov. It was 2 or 3 clicks before I got to the COVID-19 vaccine. And it's saying final decisions have not been made about who can get vaccinated in each phase, which seems to me, I don't know why that is. This should have been done by now. And if the decisions haven't been made about when, then I assume the decisions about where and how has not been made either. And it's disappointing because Rhode Island did a really good job on testing and really led the way in numbers of testing. So I was optimistic about the vaccine, organization. But
yeah,
I'm not gonna throw blame on any one place or person or role. We can do better. We need to do better.
Yeah, no, and I'm throwing a bunch of blame around just only because it feels to me like we had a 9-month head start and we could have. It's not hard to section off a group of people and say, and it doesn't even have to be, physician and frontline care workers are caring for people. They're doing testing. I get that. But you have administrative staff. You could have taken your population health person, somebody from IT, somebody from marketing, whatever, put them in a room and said, look, a day's coming when we're going to get a vaccine. It's not going to be in huge supply on the first day. So we're going to have some limitations. We want different options for you. This is what our CEO at my last health system would have done. I just know it. Fred Dempster made a comment. This has been made more challenging by governors and related micromanaging. The data infrastructure in a maturity model is or just above feeble. And I think, that's how people feel about the state. I have talked to some CIOs who have struggled with the state in terms of the reporting requirements and things they've been asked to. Dr. Lucienne Ide, who's been a guest on the show with Remedy, says the 2-dose requirement with different timeline per manufacturer makes us even more complex, especially when we don't have a good track record of 2-dose vaccines in the adults in the US. And then she talks about how they're helping to bring people back for that second dose. And we have enough trouble, as you mentioned, with the flu vaccine. This is a 2-dose regimen. And if you don't get the second, you might as well not get the first. So and Drex and I talked about this. In some cases, what they're doing is they're just handing people a card that says, on this date, come back. And people are putting that in their wallet. That's the point. That's the point we're at. And this is going to be interesting for us. Do you think this is being tracked in the EHR? You think that's how we're tracking this?
Oh, I would assume, yeah. Well, so again, if you're a hospital employee, it's probably being tracked through Occ Health, and the separation for employees between the Occ Health database and the EMR. If you're getting it through your provider, it's being tracked in the EMR. If I eventually can go to Walgreens or CVS and get it, then they're just going to have it in their system, and I'm going to have to tell my doctor, right, that I got the vaccine. So, if it's at some mass vaccine place set up at a convention center by the state, I don't know how it's going to